Hi, welcome to Checking In with Amy. I'm so delighted that you're here again to let me into your home. Today, my guest is our dementia specialist for the East Boston Neighborhood Health Center, the Elder Service Plan, which is part of the PACE program for all-inclusive care for the elderly. So our guest today is Mary Maxine Mello, who is our dementia specialist. So welcome.
Thank you very much for having me, Amy.
My pleasure. So let's just start out by asking you, how did you get into, tell me a little bit about yourself, a little background story.
Well, I started out as a physical education teacher for 15 years when I decided I needed a master's degree. So I went to Boston University, got a master's degree in therapeutic recreation, and changed careers. I began working in a skilled nursing facility, and most of who I worked with were persons who had some type of dementia. And during the 8 years I was there, I went back and got a second master's degree in creative arts and learning, so that I could understand the multiple types of learning techniques that each person possesses so that you can appropriately build programming. And when I graduated from there, I went to an assisted living facility and spent 18 and a half years there working, developing and implementing and directing a specialized unit for persons with Alzheimer's and other types of dementias. So for 2 years after that, I've been here with the Elder Service Plan, so it's 28 years that I've dedicated my life to seniors.
That's a long time, and that's wonderful. So we're blessed to have you.
Thank you.
So now, to be a dementia specialist, what made you go into that line of work?
Well, it really was a life experience. My dad was one of the millions of Americans who was diagnosed with Alzheimer's disease. And unfortunately for us, it was during the mid-70s when there was no information highway, no Google, no World Wide Web, and very little information that was out there. He wanted to retire. He was absolutely fatigued, both physically and mentally. And after he retired, during the first 2 or 3 years, we started noticing a lot of changes in him. He was becoming forgetful, socially isolating from the family, or when we had family gatherings, not really able to initiate conversation with anyone. And tasks that he had done for at least 40, 45 years, he was having trouble with the sequencing. So did the doctor's appointments and we're told, oh, be patient, he's getting old.
Right.
He was in his 60s.
Right.
That's not old.
That's
80s is old.
Yeah.
So short time later, in the early 80s, I happened to see a television advertisement that went something like this. Is your older loved one forgetting things, isolating from the family, unable to initiate, having difficulty completing tasks, getting lost? Well, it might not be normal aging. It might be Alzheimer's disease.
That had to be unbelievable.
It was shocking. I thought, with the exception of getting lost, that they were describing my father.
Right.
And it wasn't very long thereafter that he did get lost.
Oh, gosh.
And we did go back to the doctor with new information, and that's when we received the diagnosis.
So now, in order for everyone in the listening audience to understand the difference between Alzheimer's and normal aging, could you make it simple and explain that to us?
Sure. You know, that's the question that many family members ask me, staff members ask me, even different people who are participants do. When you have a dementia, and especially of the Alzheimer's type, you will forget entire conversations, entire episodes of life, entire events. You will be unable to follow written or oral directions and will not be able to take care of yourself. A person who is normally aging, you know, we all do have periods of forgetfulness, but with recall and cueing, we will remember events, we will remember stories, we will remember incidences, we are capable of following oral directions and written directions. And unless there is some type of illness or physical disability, we are able to take care of ourselves.
Right. So this is interesting. I went to Faneuil Hall not too long ago, and they had an exposition on Body World.
Yes.
And they showed the Alzheimer's brain. This was the first time I've ever seen that. And even though I've read textbooks and, you know, I've heard about it and I've taken care of patients with Alzheimer's, I've never seen the actual brain. And I could not believe when I looked at it, it was full of holes. So there was it was almost like Swiss cheese. So there were big holes, and that kind of was my first aha moment that there is brain cells missing. So can we talk a little bit about that?
Sure. Most people don't realize that your brain only weighs 3 pounds and is the most important organ in the body. It not only involves memory and thinking and planning, it's auditory, it's visual, it's emotional, it's things we don't even think we're aware of, digestion, breathing, etc. So I have a slide that shows a normal brain on one side and a person who had Alzheimer's disease by end stage on the other side.
That's interesting. Let's look at this.
So if you take a look at this slide, you see on the left-hand side that is the normal brain. On the right-hand side, you can see that there is quite a bit of damage done. It shrunk at least a third of the size. The outer part of the brain, which is the cortex, is where the remembering and thinking and planning goes on, and that shrinks drastically. The hippocampus, which is where you make new memories, or your working brain, shrinks even more than that. And then the larger holes that you refer to as Swiss cheese are ventricles, which are fluid-filled spaces in the brain. And once the plaques and tangles of Alzheimer's disease develop and collapse into the brain, these areas of the brain get larger.
So, okay, now we know why. But then, now we have families, loved ones that have Alzheimer's, and the family is beside themselves on what to do and how to act. And everyone's in a quandary. So maybe you could give us some helpful hints on that.
Sure. You know, each and every one family member, it's a trial and error method.
Right.
There are general symptoms that will be found throughout anyone who has a dementia, not just Alzheimer's disease, but how each family responds to it is based on how they view their loved ones. So I like to start with what I call KISS, and I have it on a slide, so we can refer to a slide.
That would be good.
KISS means keep it simple and serene. It's important to keep it simple and serene by reducing the 3 C's. Confusion, clutter, chaos. You reduce this in your environment by keeping the distractions down, especially if you're trying to do a task like bathing, mealtime, changing clothes, getting someone dressed, getting them ready for a doctor's appointment. The more distraction there is, the more difficult it is for someone to get ready. Increase your lighting. Poor lighting is very disorienting for persons with Alzheimer's disease because their vision actually diminishes. Keep your counters in your rooms free from clutter. Remove scatter rugs and excess furniture to create clear pathways, which will help in the prevention of falls. Identify the bathroom. Most people who are incontinent in the early stages of Alzheimer's disease are incontinent because they no longer can identify the bathroom. So there are some things that you can do to make that easier. One of the first things would be to change the color of paint on the door of the bathroom so that it stands out from the others. If you have what I call the white bathroom, white walls, white floor, white toilet, the toilet's just going to disappear into the room.
Right.
So you can identify it more by placing a black toilet seat on it so it's more easily identified. Store your sharps knives, scissors, anything else, even knitting needles, in a childproof locked drawer. You also want to think about adding door locks to the doors. And when you do, put them high or put them low, because the focus of someone with dementia is directly at their own eye level. Mm-hmm. You can also use doorknob covers, which won't spin when they're trying to open the door, so the only thing that turns is the doorknob cover, not the doorknob itself. You also want to develop a daily routine that has set meal times, bathroom schedule, and exercise. Exercise is incredibly important. And then mealtime. Mealtime becomes an issue because they forget how to eat. They forget what food is. They look at it on their plate, it's overwhelming. So you want to keep that as simple as possible. Ways to do that: make sure that you have a tablecloth or a placemat that's a contrasting color from the plate, so that the plate really stands out. So if you're using a white plate, don't use a white tablecloth. Use a darker plate on white. Using only one utensil, the utensil that they're most likely to use for the meal, will aid them in being able to eat. Removing distractions from the table. I remember my dad using salt in his coffee because it just happened to be on the table.
Right.
So remove the condiments, remove the centerpieces, and then small portions. When the plate is overwhelmingly full, they don't know where to begin.
Right.
Using favorite foods, and then make it to the point where you may have to do one portion at a time of one particular thing. So, modify your environment as the needs of your family member changes, and remember to always make safety the most important thing.
That's a wonderful list, and we can always share that with the audience at any time if they would like a copy of it. So we'll talk about that at the end of the program.
Sure.
So tell me now about communicating, the best way to communicate with someone that has Alzheimer's. What do you teach the staff?
I actually have a couple more slides with
Okay,
some
good.
pictures on them, so
Good.
can we refer to those? The most important thing for anyone is to focus on the person, not on the task. We are in such a rushed society of gotta get this done, that the person becomes a shadow.
Right.
And we can't afford to have somebody with dementia continue to be a shadow. You want to approach them at eye level. The Alzheimer's Association came out with a bulletin a couple of months back that their ability for someone with dementia to see is like taking your hands and turning them into binoculars. And that's where their focus is. Seeing above, to the side, or below is not where their focus is. And remember, there's a difference between what you can see and what the brain focuses on.
Right.
Because we actually have a greater field of vision than what we actually focus on. Identify yourself. They're going to forget who you are at some point. So when you go to do any personal care with them, saying, "Hi, Amy, it's Mary." You've identified yourself, so you've gotten rid of that moment of fear with who's the stranger coming in. And that gives them a feeling of safety.
Well, this is funny you should say that when you said, oh, tell them your name. My name's Amy. So I had an aunt, Bert, and she had Alzheimer's disease, and she was in a nursing home. And I know all this, you know, book-wise, but my heart worked a little differently. So I went to see her, and I said, "Hi, Aunt Bert, it's Amy." And there was no acknowledgement. So I went on, and I said, "Aunt Bert, it's Amy. You know, Claire's daughter, Amy," who was her sister. And there was no acknowledgement. So now I'm going one step further, and I said, "Aunt Bert, it's Amy. You know, Claire and Sammy's daughter, Amy," and there was still no identification. So even though we read that, you know, and we see the brain, this is touching my heart because she didn't know me.
It is one of the most difficult things to accept. We so want to make that connection with our loved one that when we say who we are, that they're
going to know.
recognize it and they're going to know. And it makes it very, very difficult
Right.
for all of us. So continuing, it's also important to call them by name. You know, your name was the very first thing you heard probably as an infant.
Right.
And continuing to use their name brings focus to them because you're talking to me, you're not talking to someone else. It's also very important to remember to speak slowly and distinctly so that they have the opportunity to hear and understand what you're saying. One of the biggest mistakes we make in the English language is you need to avoid confusing and vague statements such as, oh, just hop in. Mm-hmm. Because they may do literally what you say and hop in, because the ability to understand that nuance in the language isn't there. So you want to describe the action exactly. Go sit in your rocker, as opposed to go sit in the living room, because you may walk in and find them sitting on the floor. Limit distractions so that you are able to focus on them and they are able to focus on you. Get rid of the TV, the cell phone, especially when you're doing personal care. Giving one direction at a time. Mm-hmm. Allow them to absorb that direction. Repeat it if necessary, because they're going to need time to do that. And tell the person exactly what you're doing. You know, if you can enlist their help in doing it, as much as they're able to, that's wonderful. One of my favorite stories is about an aide in one of the facilities I worked to who is doing everything right, talking to him, forgot to tell him she was going to take his shoes off, and when she reached down, he kicked her.
Right. He got frightened.
He was frightened. And one of the most difficult things is to remain calm and patient. It's a harrowing day for a caregiver of anyone with any type of dementia. And you're at your wit's ends.
Right.
And primary, staying calm, staying patient is so hard to do at the end of the day. So any little time you can give yourself a break will help you in your ability to communicate with your loved one. Remember to cue them through what you're doing. Don't just begin something without letting them know what it is you're going to do. Don't raise your voice or speak sharply. You wouldn't believe, but we actually communicate through the tone of our voice as well as through facial expressions. Avoid arguing. You're never going to win an argument with someone with any type of dementia. It's important as well to communicate with your own face. So not just verbally, but communicate pleasant facial expressions with them. And remember, don't crowd them. Don't corner, don't restrain. Our first response to somebody who's trying to get out a door is, no, don't do that.
Right.
And we chase toward them and we try to grab them to turn them around. And what you've done is you've instigated our normal fight or flight syndrome.
Right.
And they're going to turn around swinging. There needs to be redirection with verbal cues, talking quietly, and you know what? Walk through that door with them. Get them outside, distracted, turn around and come back. But above all, we need to remember to smile and to treat them with dignity and respect.
Thank you so much.
You're very welcome.
When you and I met many times, I have a list of what I say are my, sentences that mean a lot to me, meaningful sentences. And when someone is in need of cheering up or whatever, I send one of my little sentences along to them. So you shared a sentence that I would like everyone to share today. So if you could just read that to us.
Sure. The sentence to me is very heartfelt for anyone who works with people with dementias. We cannot change the wind, but we can adjust the sails. We'll never be able to change the course of Alzheimer's disease, but we can change how we react and how we take care of people to give them a sense of safety and love.
Oh, thank you. Mary, this was wonderful.
Thank you so
I see
much
why
for having
you're
me.
being called a dementia specialist. You have, first of all, your tone, your voice, everything is very calming, your facial expression, just everything. It was wonderful. So thank you.
Thank you so much for having me.
My pleasure. So what I would like to do now is what we call an up and out. It's called Check It Out. And it's a short video that I think you'll really enjoy, and then come back and I have a few closing words.
Ladies and gentlemen, please welcome Mary Maxwell.
Sorry, God. As long as I have the microphone. There are a few things I forgot to mention. First of all, just to introduce myself a little. Over the years, I've noticed that the two things most people want to know about you are the two things they're far too polite to ask. So let's get that out of the way. I'm 72 years old. And I weigh 145 pounds. As you know, we seniors are sometimes not very likable, let alone lovable. So Lord, could you please continue to keep the people of Home Instead patient and aware of why we are the way we are. And Lord, please remind them that the thing about old age is that you don't get a chance to practice. This is the first time I've ever been old. And it just sort of crept up on me. There were signs. Random hair growth, that's special. Particularly that first time you go to brush a hair off your lapel and discover it's attached to your chin. You turn your left turn signal on in the morning and leave it on all day. Non-life-threatening skin growths large enough to name after deceased pets and relatives begin to appear. And neck tissue seems to develop a life of its own. Last November, I was afraid to leave the house Thanksgiving week. Aren't you quick? You do strange things as you age, like driving up to a curbside mailbox and ordering a cheeseburger and fries. And Lord, I know you're aware that one Sunday at church I put my Dillard's bill in the collection basket by mistake. And last Easter, after services at St. Cecilia's Cathedral here in Omaha, my husband stopped to talk to a friend, and I went on out and got in the car to go home. Gentleman sitting behind the wheel said, "Oh, are you going home with me?" And I said, "Oh, Archbishop, I'm so sorry." I won't even mention driving into the wrong end of the car wash. People get so excited when you do that. I don't know why the lady in the other car was screaming like that. I was just as surprised to see her as she was to see me. I also won't mention discovering that you're wearing mismatched earrings and going home to change them and ending up wearing the other mismatched pair. And you know, Lord, that it's hard for old people to exercise. I did try to jog once, but it makes the wine just jump right out of your glass.
So, thank you very much for joining us once again for Checking In with Amy. I hope you enjoyed today's segment. I certainly did. And if you would like more information on what the topic was today, there are a number of things I want to tell you. First of all, there's a resource list up on the screen now, and we would be glad to send that to you, along with any helpful hints that Mary Maxine Mello shared with us today. I also just want to let you know that you can call us at area code 617-568-6377. You can email me at checkingin@ebnhc, which is East Boston Neighborhood Health Center.org. And so, until we meet again, please be well. Thank you. Bye now.
My parents were always very independent. They always seemed to take care of each other. My dad met my mom when she was 13 and he was 15, so they got a lot of practice. It was really difficult when they were faced with health challenges and started to need some help. It was also really hard on me and my brothers. It seemed like every day we were getting calls. They needed to go to this appointment or that appointment, and it became pretty apparent that they really couldn't live on their own without some help, and more importantly, stay healthy. We're lucky to find the Elder Service Plan. Almost immediately after enrolling, we saw some real change for the positive. All their medical appointments were in the same location, including the prescriptions. If they did need to go to see a specialist, then transportation would take them, and that was a big relief for us. My mom attended the PACE Day Center each day where she could really socialize, and she loved that. When they needed services in the home, that was a big help too. And my dad, he'd still call me every day, but not because he had to, because he wanted to. He'd say, "Stevie, you won't believe it, they fixed my teeth. They got me some new shoes today." Just brought some amazing stability to the family. I'll see you a little later today, okay?
Okay. My name's Lucas Akerley. I'm the activities coordinator for the Elder Service Plan in Winthrop. Today we're doing active parachute games. We have a ball toss with some music. It's fun. Keeping active at ESP is part of our plan to keep you happy, healthy, and independent.
Our mission at the Elder Service Plan is to keep our participants living safely in the community. And we do that in a number of ways, the first being with the physician and the entire team to take care of the person medically. We also try to think creatively and provide other things that they may need, be it shopping service, laundry service. We may provide respite for the caregiver, or even aid visits in our supported housing. We try to be as flexible as possible here in the Elder Service Plan to reach the goal of keeping our participants living safely in the community.
My name is Patty Ferranti, and I'm with the Elder Service Care Program, and I absolutely love it. Just talking about it right now makes me want to cry. Before I was in the ESP, I was always calling my family and having them, pick me up to take me to doctor's appointments and stuff like that. And now now that I'm in ESP, I have the door-to-door service, coordinated care. My doctor always knows I'm coming. They always arrange my appointments. Everything is just so perfect. The program is fantastic. It really is.
Any pain when you do that? As a physical therapist in the Elder Service Plan, a big part of my job is to help people keep up with their strength and balance. A lot of times I see people after they get injured or some type of surgery, but another part of my job is to make sure people stay active with a regular exercise program so they don't lose the strength and balance they gain back.
What we do is we talk to the person to find out what they want. Do they want to increase their endurance, their strength? Do they want to be able to do things easier throughout the course of their day? We will work with them and develop a plan, and we move forward with it.
We try really hard to keep up with the mission of the program, which is to keep people in the community of their choosing for as long as possible and as safe as possible. Even sometimes just a cane or a walker can make all the difference in making sure people stay safe.
Very central to our plan and what we do here is the patient, the person. And the way we deliver that care is by having a care plan which centers around the person's goals, their choices.
As the medical director for the Elder Service Plan for the last 25 years, I've had the pleasure of watching our program grow enormously. While we started out largely in East Boston, we now serve participants in Chelsea, Revere, Everett, East Boston, and Winthrop. I think one of the real great reasons for our success is our ability to comprehensively coordinate our participants' needs. It's not just seeing the doctor or the nurse. Pharmacists, activities directors, nurses, nurse practitioners, van drivers, dietitians, all of us work together under one roof to keep our members healthy, active, and independent.